Which of the following best describes the purpose of an exposure control plan in the healthcare setting? Now, let's say during the exam you see this exposure control plan, but you're not sure offhand what that means. You could still use the context to understand how to answer this question, because if you take a look at control, that means that it's a plan to control or mitigate the situation. So you know that it's going to be some sort of response and some sort of plan on how to respond to a situation that involves an exposure. So let's keep that in mind as we answer this question. So choice A says a plan to ensure maximum exposure to sunlight in the facility. Now, let's say you're not sure what this exposure control plan is, and you might be a little thrown off when you see option A, because you might think, oh, exposure to sunlight in the facility, oh, that sounds like a good thing, and when you're in the facility, sometimes you don't have that much sunlight in the office. That could be a good sort of plan. However, it's stating control plan, and when we were discussing this, we were talking about a response to a situation, so it sounds like it's in a response to something that's a negative, and not trying to create some sort of exposure that would be a good thing. It looks like we're responding to some sort of bad situation. So we can eliminate option A. Option B says a plan to control the exposure of healthcare workers to the media. Now, option B might sound good because it says controlling exposure. It looks like here we're trying to control exposure, but it's saying healthcare workers to the media. Now, do we think that this is really a major issue? I mean, if you think about when you're in a doctor's office or a healthcare facility, how often is the media really coming in and trying to interfere with the place of work? It doesn't seem very likely. We could leave it open for now and look at the other choices, but that probably is not something that's used in an exposure control plan. Now we take a look at option C. It says a plan to expose patients to different treatments. Now, when we see exposing patients to treatments, this looks a lot like the issue we saw with option A, because option A looked like a positive thing. We wanted to increase exposure. However, that we were saying that the exposure control plan seems like it's in response to something negative and trying to treat an exposure instead of trying to cause an exposure. So we could eliminate option C. That doesn't sound right either. Option D says a plan detailing the steps to take in the event of an exposure to potentially infectious materials. Now, this matches what we deemed to be the meaning of exposure control plan, and that is correct. So the exposure control plan is a plan to help mitigate a situation that involves an exposure to potentially infectious materials, and it's the plan to take in the event that a patient or a healthcare worker is exposed to some sort of toxin, and how to help alleviate any symptoms involved in that. And therefore, option D is the best choice. Going back to option B, a plan to control exposure to the media, that actually was just something made up to try and trick you and try and get you to pick that choice. So we can eliminate that. So now we know what the exposure control plan is, and we could also understand that if you weren't familiar with this term, how you could use the context to try and figure out what the answer is, which in this case is option D, the plan detailing steps in the event of an exposure.